Those restrictions and curfews will be in place. You know, people are still going to celebrate the New Year's Eve. To remind us how to keep the holidays safe is Chief of Staff over at Palm Beach Gardens Medical Center, Dr. Shady Salib. Thanks for joining us.
Hi, Jim. How are you?
Good, good. So, first of all, tell us a little bit about some of the precautions people should take beyond just the masks and social distancing. Are there other things we should do?
As you know, Jim, we are just getting over the aftermath of the Thanksgiving, trying to recover from the increase of the numbers because of people getting together and our viewers meeting family members. Now we got the Christmas and then the New Year's gathering. I'm assuming that hopefully our viewers will understand that we need to limit the gathering and the celebration, and if needed, to a minimum of a few family members that you are aware, that you are, trust and know haven't been out. If needed, please make sure you wear your mask, keep your social distance of 6 feet apart. Make sure if you touch anything like a drink or an appetizer, or you are touching something that you need to use for food, to wash your hands vigorously in between. Make sure not to touch your nose or your mouth, so this way you can prevent the transmission from an asymptomatic patient yourself.
We were just talking about curfews a little bit ago, and I had some viewers reach out to me. They're very confusing me. Why curfews? Is this really going to help reduce the spread of COVID? We would like to hear your thoughts on that.
Well, you know, Luli, if we kind of put the curfew there as a reminder that if you're planning on going out and socializing and celebrating, maybe the curfew will be something that will discourage you from doing that, or doing it at the safety of your own home with your immediate family members, instead of going out and partying with strangers and getting exposing yourself and people that you don't know being exposed to something like that. So I would say the curfew is something that's good, just as a reminder and to encourage people not to go out and about.
And Dr. Salib, talk a little bit more about, do we normally see spikes after holidays? I know we've said that. In some areas, that's true. I'm just curious. I mean, do you buy into the idea that as soon as we have these holidays that we see a spike?
So it takes 2 weeks minimum, Jim, and maybe 3 weeks to see the spikes. I was just talking to my colleagues in the ER how they're doing this past few days. And to tell you the truth, we started seeing spikes, not particularly because of the Christmas gatherings. Could be from the shopping, going out for shopping for Christmas. It could be the leftovers from Thanksgiving. It takes a couple of weeks for a carrier, a normal carrier or asymptomatic carrier, to turn into a positive COVID patient. I'm seeing a lot of patients every day now that are being diagnosed as symptomatic, and in various age groups. And you know what? The age group is getting older because the younger people go out and about. They get the infection, they give it to their parents and their grandparents. So I have an array of ages between 19, 20, and 68 to 70.
Wow.
That's all the time we have. Dr. Shady Salib, he's the Chief of Staff at Palm Beach Gardens Medical Center. Thank you so much for joining us, for talking to us about how to stay safe this New Year's.
Thank you, Luli and Jim. Happy New Year.
Thanks. Same to you. All right.